Well, this morning, Alfred's been contacted by a listener, Mr. Hughes, who's concerned about the queues at Boots Pharmacy on Shaftesbury High Street. Around 40 people today. He says he's new to town. He's told it's like that every day. And it's not yet deep winter. He says it needs sorting out. The problem is that pharmacy licences are issued per town. Shaftesbury has two, one held by Boots, the other by Jehoots. And Jehoots, near the Abbeyview Medical Centre, hasn't had a pharmacist for weeks since June. The chain that bought the former Lloyd's Pharmacy network is in financial trouble. It's made national headlines. Staff haven't been paid, so they can't recruit pharmacists. And they can't dispense prescriptions. That's put extra pressure on the staff at Boots, who've been praised in Parliament by the Health Minister Stephen Kinnock and our local MP Simon Hoare for picking up the slack. Today, Simon's meeting staff at the Abbeyview Medical Centre to see what, if anything, can be done. He says the wheels are turning nationally, though. It's widely felt that Jehoots hasn't met the terms of its contract, but there's a loophole. Finding another provider to operate a second pharmacy in Shaftesbury isn't straightforward. Simon joins me now. He's actually parked outside Jehoots. In simple terms, Simon, the NHS can't just tear up the contract with Jehoots, remove them. They can't just bring in another pharmacy company. It's not that simple, is it?
No, it's not. Because who is the other pharmacy operator waiting in the wings? Lloyd's have pulled out of our region. Would Boots take it on? There's a whole, possibly. There's a whole raft of regulations which govern if a GP surgery goes into the dispensing service as well, so it doesn't have an exploitable monopoly over other operators. So it's not that easy. It's not as if there's, Pharmacy X sitting in the wings in what are now, I think, 120 locations around the Greater Southwest, where Jehoots have failed, have closed their doors to prescription dispensing. There isn't another operator waiting who could come in at 9 o'clock tomorrow morning and start doing it. That in essence is the nub of the problem.
And in terms of, if you like, getting them out, to use a simple way of describing it, nobody foresaw that you'd have somebody who held one of the two contracts for Shaftesbury but didn't supply the pharmacist required to deliver what was expected of them. It just wasn't considered anybody would ever do that.
Precisely. There's, the regulations deal with if there's a fire in the pharmacy or if the pharmacy has been flooded out and it needs to move to temporary licensable accommodation. All of those things are governed. It was never envisaged at the time when the regulations were written that a company that effectively made its bread and butter on being a dispensing pharmacist would choose not to. And, this is an issue which has come out, certainly in the urgent question that we had in the House of Commons the week before last. Subsequent to that, and in conversation with health ministers, and if anybody listened to my question to the Prime Minister last Wednesday and the Prime Minister's reply, I'm getting a very clear indication that the patience is now wearing thin, and the silence of the regulations really cannot be the resting spot for the defence for inactivity. I'm just picking up that across government there is now an appetite to be a little more proactive and a little bit more energetic in terms of clearing the decks of Jehoots. Well, that's great because you've then got a clean sheet of paper to start with. But it still goes back to my point: who fills the gap? Now, patients who have been using Jehoot surgery pharmacy in Shaftesbury have effectively three options. It's to physically use Boots in town. It's to advise the doctors, particularly if they have repeat prescriptions, to nominate another dispensing pharmacy outside of Shaftesbury. But that's great if you're travelling, but if you haven't got access to a car, etc., that's very difficult. And the other is that I know that there's advice out there, and certainly my office can help, if anybody wants to use an online pharmacy service but doesn't quite know how to go about registering for it. Is any of that perfect? The answer to that is no. All of the authorities recognise that Shaftesbury, and it's not just the town, but it's the villages surrounding it that look to Shaftesbury for services, that the size of population certainly supports and warrants two operating pharmacies. So we are operating at 50% capacity, which is not a satisfactory situation to be in.
So briefly, because I know you have a meeting in a second, looking at the national picture, that's work in progress, but it is a national thing, which might be slower. Locally, you're talking with the Blackmore Vale GP practice, Abbeyview Medical Centre, because of the impact that we've already discussed with them that's having on them. But also, you're going to see whether Boots can do anything. They can't make a bigger premises, but maybe they can somehow help out, although they've been recognised for the workload the staff are undertaking and how they're rising to the challenge.
Exactly. And again, you give me an opportunity to thank the staff of Boots and the pharmacists there for rising to this challenge in unforeseen and unpredicted circumstances. Now, we can't make, or Boots cannot make its physical current premises larger. Whether there is scope for it to take some additional floor space in the town and maybe decant some of its non-pharmacy services out of that, I don't know. If we got Jahoots, or when we get Jahoots out of the pharmacy here, which I'm literally parked at it, looking at it as we're having this conversation, might they be interested in taking that? Might the surgery, might Abbeyview want to become a dispensing surgery and operate it? There are some options out there. None of them are quick. None of them are easy. And it's easy to say, it's difficult to do. We all just need to be a little bit patient about this. But I just want listeners, Kerry, to understand very clearly that anybody who needs to be alert to this is alert to this situation. And we are all working flat out in our various ways to try and get it resolved satisfactorily for local people. So nobody's sort of asleep at the wheel. Nobody's ignoring this from number 10 down. Everybody is alert to the very real negative impact what is a very significant corporate failure is having on so many people in so many constituencies across the country. I think it's about 82 constituencies are affected at the moment and possibly rising.
So our Conservative MP, Simon Hoare, is on the case, as is, he says, the Labour government and the Health Minister. They're aware of the problems, as are the team at the Abbeyview Medical Centre. And, of course, credit's been given to the staff at Boots here in Shaftesbury, coping with an exceptionally heavy workload. It's not as simple as building a new pharmacy and opening the doors. Pharmacy services are tightly regulated, licences limited, and recruiting qualified pharmacists in rural North Dorset a challenge, just like finding GPs. The bright lights of the city often prove more attractive to newly qualified practitioners. We will keep you posted. There are options. Now, the NHS have said you might want to take your prescriptions elsewhere. They can't recommend a certain pharmacy. Boots are good in Shaftesbury, but the queues might put you off. We've been told good things about Marnell, if you can get there. There are also online options. If you're not sure about how to do it online, then I know the Digital Champions, the free service at Shaftesbury Library. They can give you help and assistance. Call into the library for more information.